PEHP as I go out and educate people about Medicare. My goal with that is to try to give you some knowledge so that once you get into what I lovingly call the Medicare world, you can make some great choices for yourself as you go forward. So I did check with CNN this morning, and we still have Medicare. It is still a national health insurance program, okay? So as we go forward, a lot of people will ask, Gabby, who is eligible for Medicare? So obviously, if you're age 65 and above, but also if you have certain disabilities and end-stage renal disease of all ages. So the most confusing thing I find for people is the Medicare Alphabet. And so Medicare Part A is just inpatient hospitalization only. That's its function. Medicare Part B, as in boy, is all of your outpatient services, physician services, diagnostic labs, tests, and x-rays. Medicare Part D for drug is the only alpha that makes any sense, right? And then we have the new option, those Medicare Advantage plans, which are also called Medicare Part C. Those terms are interchangeable, and Medicare Advantage plans are a Medicare plan. They act as Medicare. So as we go forward, if you look at your initial enrollment periods for Medicare A and B, it's the 3 months before your 65th birthday, the month of, and the 3 months after. Now, everything in the Medicare world begins the first day of the month. So if it's Medicare Part A or B, first day of the month. Part D prescription drug plans, always first day of the month. Any type of Medicare health plan is also always going to be effective first day of the month. So the one thing about Medicare that makes them unique is this. If you happen to be birthday is the first day of your birthday month, in their mind, they'll make you effective the previous month. It's kind of funny that way how they work. The other thing that you need to keep in mind is if you want your Medicare A and B to be effective the first day of the month of your birthday month, you need to apply the 3 months before. If you apply your birthday month, it will be delayed. If you apply that month after that, it will be delayed again. And if you apply that third month, it will be delayed again. So just keep that in mind as you're coordinating leaving active group employment coverage into the Medicare world. So every year there is a general enrollment, January through March, effective July 1st. And a lot of people ask me, well, Gabby, how do we enroll? Well, for some people, it will be automatic. So if you have Social Security, either due to a disability or you've decided to take it early, right, at age 62, guess what? You will be automatically enrolled in Medicare at age 65. Enrollment is also automatic for Railroad Retirement Board benefits. And if you're under age 65 and disabled, your Medicare benefits, A and B, will begin the 25th month after you've been receiving 24 months of benefits from Social Security, cash benefits on disability. If you have ALS, which is Lou Gehrig's disease, your Medicare A and B will become effective the first of the month that you start receiving Social Security benefits. So what happens to the rest of us if we're not automatic enrollees, right? Well, you go in and sign online, of course. And I always like to give a shout out to Medicare's website. They've really changed it up. It's easier to navigate. The last 3 years, they've done some fabulous things. So one of those things is where you can sign up at. There is a link in there that will actually go over to Social Security and let you sign up for Social Security as well. Now, when you go in to sign up, you're actually creating an account. They do that to help protect you. And to sign up for Medicare Part A and B, it's easy. It's about 10 to 15 minutes, okay? And so you can do that and sign up for it that way. If you get a phone call, you can pause it and then go back in and continue to apply for it. Okay, so again, this is more on what that website looks like, and you can see it's easy to navigate. So how many in here, please don't make me a loner, are working past age 65? Thank you. Okay, let's talk about working past age 65 for a moment. There's some things I would like you to consider. Number one, the type of health plan that you have, coordination of benefits, and length of employment, okay? If you are working past age 65, the first thing that you need to know about is what type of health plan do you have? If you have a qualified high deductible health plan with a health savings account, PEHP refers to those as our HSA star plans. When you sign up for Medicare A, they will backdate your coverage 6 months if you're past age 65, okay? So let's say, for example, you are enrolled in a qualified high deductible health plan, and you are now, let's say, down the road, 67 or 68, they will backdate it 6 months. They can't go past your initial enrollment period. But how does that affect you? Well, it could affect you being able to have your employer put money in your HSA and you put money in your HSA, okay? Because our friends at the IRS say the only way you can have things put into your HSA account, right, is if you're enrolled in what? A qualified high deductible health plan. So just keep that in mind as you're going out the door for retirement, is to make sure that you stop and have your employer stop putting contributions into your health savings account about 6 months prior to you leaving. Okay, coordination of benefits. Oh my gosh, I've been in the insurance industry for, I'll just say decades, okay? And when you, back in the day, if you had double coverage, it was really close to double coverage, right? Is it like that now? No way, no way. There are state guidelines that we have to follow, federal guidelines that we have to abide by. And also, remember, if you have insurance in your name, it always pays first or primary. And then it would go to your secondary payer to pay. Now, with that said, remember, the secondary payer will never pay more than the primary payer paid. Does that make sense to everyone? So you're never going to get to 100% benefits. Now let's talk about our friends at Medicare. It's based on the size of your group, but for most groups that are large, Medicare will always try to be the payer of last resort. That's exactly what they refer to themselves as. I'm in marketing, I'm very visual, so I always think of, you know, the Bates Hotel with the light blinking, open, open, open. I think of Medicare's hotel, payer of last resort, welcome to Medicare, and blinking red lights, just trying to make you guys laugh, right? So just remember that as you're going into the Medicare world. Length of employment, okay? It is your job to make sure that you have coverage from once you leave active group employment coverage to when you go into the Medicare world. That takes a little bit of coordination on your time. So remember, Medicare always starts when? First of the month. So if your employer's active group coverage that you have either through yourself or your spouse ends date of termination, you're going to have a gap in coverage. Does that make sense? So you may have to take a COBRA plan so that you have continuous medical coverage until your what? Medicare starts and your Medicare health plan starts the first of the following month, okay? So keep that in mind. Now, the other thing that you need to remember is all of us can what we call delay our Medicare Part A and B enrollment as long as what? We are employed with an employer that has 20 or more employees, right? And that the coverage is what they call meeting essential benefits. And most of the medical plans meet essential benefits. So with that said, Medicare uses this term called actively employed, right? Group coverage. And so you have to think in Medicare's terms that you have group coverage that you're getting in the car to go to work every day and you're getting a paycheck, right? That's how they think. So if you're on early retiree coverage, does that work? No. If you're on COBRA coverage, does that work? No. So you can only delay your Medicare Part A and B coverage if you are actively employed or your spouse and you have actively employed group coverage through that employer, okay? Now, if you've worked past age 65, no worries. You didn't need to notify Medicare, right, that you're still actively employed. It's on the back end. And briefly, since we have someone here with that, what happens is, let's say you're working past age 65 for an employer, or maybe your spouse is, right? So what you will have to do is it's like a letter, and basically your HR team completes it for you. And it attests to the fact that you've had active group employment coverage, right, past age 65, so that you do not get a penalty, right, for not enrolling in Medicare Part A, B, or if you choose C or Part D drug plan in a timely manner, okay? So when can you enroll? You could enroll anytime that you still have active group coverage, right? And that's what most people do, because you want to make sure you have everything set up, ready to go. You cannot obtain a Medicare health plan, whether it's a Medigap plan, Medicare Advantage plan, or a Medicare supplement plan, unless you have what? Medicare Part A and B. So you can see it takes some advanced planning on your part to ensure once you leave active group employment, that first of the month, you have Medicare A, B, and D, and a Medicare health plan in place, and you're ready to go, okay? The letter that your HR team fills out, you can either mail that to Social Security, or you can make an appointment with them and take it into them, okay? Are you guys having fun yet?
Almost.
Okay. The other thing that they say is, oh my gosh, they say you can apply during the 8 months from coverage ending or your last date of employment. To me, that's an oxy, right? Because you have to have Medicare A and B to get what? A Medicare health plan. So don't do that. Make sure you have everything in place and you're ready to go. Okay, so there are penalties. And that's why it's so important for those of us working past age 65 to ensure that Medicare is aware that we've had active group employment coverage. So if you do have to pay for Part A coverage, that is inpatient hospitalization, there is a penalty, and there is a penalty for Part B as well. Now that one is serious. They actually count the months, people, in the Medicare world. And that penalty stays with you for the rest of your life of having Medicare Part B as in boy. So what does Medicare cost? So let's talk about that. The good news is for most of us, Medicare Part A, which is inpatient, is at no cost for us because either you or your spouse, either one of you, right, has worked 40 quarters or more at an employer while paying what? Medicare taxes, okay? But what a lot of people don't realize is there may be some individuals that don't meet that criteria. Look at what they'd have to pay for Medicare Part A. And again, you have to have Medicare Part A to go into the Medicare world. So 40 quarters, 10 years, okay? All right. So then, Part B. Now this gets really fun. Medicare Part B, as in boy, is what? Outpatient diagnostic labs, tests, and also physician services, okay? The standard cost is $135.50, but wait, there's more. It's based on your modified adjusted gross income. So for 2019, Social Security is going to be looking at your tax return, right? Your modified adjusted gross income as reported from 2017. Why did they look at 2017? It's not because they're slow, wink, wink, nod, nod. It's because that's when they get the completed information, okay? Does it change every year? Oh yeah, sure, you betcha. So in 2020, they would be looking at what? 2018, okay? It changes every year, but the rates would be in place from them for that calendar year. So it's going to change every calendar year. Okay? Do you want to see what the tables are for this year? Now, I always tell my boss, this is one of the benefits of me being a quasi-state employee. I'm always going to pay the standard rate. So I'm in the 135.50 bracket, okay? But you can see, based on income, on your modified adjusted gross income, that can increase. And usually, it will catch all of us for that 1 year that we were still working, right? And then we went into retirement. So just be aware of that. The other thing I want you guys to be aware of is what happens when you take money out of your 401k? It's income. Could it change this? Yeah, sure, you betcha. I had a wonderful woman decided to celebrate her retirement with her family. She paid for everyone to go to Disney World. I am talking airfare, food, the hotel, everything. It was a huge bill. I'm like, are you kidding? Anyway, so it increased, right? So she was bumped up. Okay, the other thing. I had someone that needed to get their hands on some money. Instead of taking a loan from their life insurance policy, they cashed it out. Did that go as income? Oh yeah. Did that bump up what they were to pay for that year? Yes. Okay, if you buy or sell anything, okay? I ran into a fabulous couple. They had built up a rental business that would make you green with envy. But guess what happened? They had to sell it because, of course, none of the kids wanted to take it over. They'd have to work. Sorry, I'm just trying to make you guys laugh, okay? So they sold it. Can you imagine when it came around? For 1 year, they were in that bottom bracket. Now, I had a finance director with me at one of my meetings, and he says, Gabby, please don't feel that bad for them. Do you realize how much money they make to have to pay that much money? And I said, okay, yeah, I get all the zeros, but still, they shouldn't have to pay that, right? Okay. So that's how that works. So I want you guys to be aware of that. All right, so as we go forward, let's talk about Medicare Part A and B in a little bit more detail. Medicare Part A, again, I'm going to keep this going at you, is inpatient hospitalization only. It has a deductible, but the deductible works totally different. It's based on a benefit period. OMG, what's a benefit period? Okay? A benefit period begins the moment they come to you and say, guess what? We're going to place you as an inpatient, okay? And it will last 60 consecutive days until you've been released from the hospital, right? So let me give you an example. Let's say you've been released from the hospital for 60 consecutive days. These people count the days, okay? And you go back in, let's say at day 30, right? Will you have to meet that deductible again? No, because you're in the same what? Benefit period. In most cases, you will not need to meet that. Okay, let's say you've been released from the hospital 80 consecutive days and you go back in. Would you have to meet that deductible again? Yes. Okay. Now, the good news is, OMG, they'll cover the first 60 days. Yay, us, right? Now, after that time period, you can see there's a copay for days 61 to 90. And then after 90 days, it's like, what? Lifetime reserve days, Gabby, are you kidding us? This is my disclaimer. I do not make up these Medicare terms. They do a great job just by themselves, okay? What is a lifetime reserve day? The moment that you sign up for Medicare Part A, you have 60 lifetime reserve days that you can use, and they are just used for those hospital stays from 91 and beyond. Does that make sense to everybody? So it's not as bad as it sounds, but that's what they're used for. Okay. So as we go forward, let's talk about skilled nursing for a moment. Okay? Skilled nursing means that you need the assistance of a skilled nurse. Usually it's rehab, right? Usually maybe you have a PICC line, wound care, things like this. That's skilled nursing. Yay us, they pay for the first 20 days. It does follow a benefit period if you end up in rehab, okay? And then there is a copay past 21 days. And then, OMG, nothing after 100 days. Why do you think they would say that? Because you have to show improvement. If you're not showing improvement, then they'll either have to do the surgery again or figure something else out or start the process over, okay? Does Medicare cover for long-term care? Bathing assistance, bathing, changing, eating, daily functions? No. Will your kids? Just say no, okay? They won't, right? My granddaughter is the best. She'll go get me a Diet Dr. Pepper and something chocolate, just like that. She's the best. That's the only long-term care I'm going to get out of my family. Just kidding, trying to make you guys laugh, okay? All right, let's talk about Medicare Part B as in boy. Remember, that's all of your outpatient services, diagnostic tests, labs, and x-rays, and physician services. This is based on a calendar year. There is a deductible of $185. Once you've met that deductible, you are responsible for a 20% co-insurance. Now remember, Medicare is only going to cover Medicare eligible services, okay? And it's based on their fee schedule. Now, I'm going to give you another word of the day. Part B excess fees. Gabby, what is that? Okay? If you're seeing a physician, right, if they accept Medicare fees as payment in full, we call that Medicare assignment. That means they cannot charge you above the Medicare fee schedule, okay? You may run into a physician that says, I'm not going to accept Medicare's fees as payment in full. And our friends at Medicare do two things to protect us. Number one, they say that's fine to that provider, but they charge them and they have to accept a lower fee schedule. And two, they also say to that provider, you can only charge a certain amount above that fee schedule. It's called a limiting charge. So what do we see that's most common is that physicians will limit, right, the amount of Medicare patients that they may see. But it's easier for them to be a Medicare provider because then the claims are filed electronically for them. Okay, so do you need additional coverage? Yes, and the days of just having Medicare Part A and B on its own are long gone. You're just not going to be able to make it work. So what would work for you guys? And you're going to say, Gabs, you got to give us some directions. Okay, I brought you a flow chart. How's that? Okay, we are lucky now because we have two choices, right? You can do original Medicare, is what they reference it to, and it's Part A, right, inpatient hospitalization. Part B, you would obtain a Medicare supplement, and then you would have to get a Part D prescription drug plan. Or the new route, we can go Medicare Advantage plans. They act as a Medicare plan. Do you still have to get Medicare Part A and B? Yes. Okay. Most of those include a Part D prescription drug plan. If they don't, would you need to get one? Yes. Okay, so let's talk about it. What would work good for you? A Medicare supplement or a Medicare Advantage plan. So Medigap plans, Medicare supplement plans, they're standard plans, A through N. Not all of them are being offered anymore. Not all of them will be available in our state, okay? The benefits are exactly the same for all of these Medigap standard plans. Whether you purchased it from AARP, Blue Cross, Aetna, United, it doesn't matter. These standard plans are all the same. What do you think makes them different? The rates. It's just the rates, okay? So these are standard plans. What would your provider network be? You would use Medicare providers and facilities located throughout the United States, okay? Not all of these plans offer out-of-country coverage. The rates are based on your age. So if you have a birthday, which most of us do during the calendar year, they give you a good birthday present, they raise your rate, okay? Now, the other thing that you have to remember about these plans is they have a true one-time open enrollment. And that open enrollment begins when two things happen, okay? One, you're age 65, right? And two, when you have Medicare Part B. So for some of us that have delayed Medicare Part B, either because we're working past age 65 and we're enrolled in a qualified high deductible health plan, that open enrollment will not begin until those two things are in place, right? And you have 6 months. If you miss that, they'll ask you medical questions, okay? All right, now let's talk about those new Medicare Advantage plans, which are also called Medicare Part C, right? Terms are interchangeable. So with those plans, you need to live and reside in their service area. So they're offered by county. So you would have to ask if that Medicare Advantage plan was offered in the county that you live in. Now, these are the plans that are offered at low cost or no cost, right? Would you still have copays for services? Yes, you could. Okay, most of them do not have out-of-country coverage, but if you are traveling to see grandchildren within the United States, or in my case, traveling to get away from them, sorry, I've babysitted a lot this week, I'm like, anyway. Okay, they do have to follow Medicare's guidelines on urgent and emergent care while traveling within the United States, okay? Some plans may ask you to get a referral to see a specialist, and most of these plans have a specific network of providers that you need to see. Okay, Medicare Advantage plans have that same initial enrollment period that we talked about, right? 3 months before your birthday, month of, 3 months after. They have an open enrollment period every year, October 15th through December 7th, with benefits that would begin January 1st. They have a plethora of special enrollment periods. That was on my grandson's word list, okay? So you can check those out, and everything that I am speaking to you about is in this great read, Medicare and You. If you didn't get one in the mail, it is available to you on Medicare's website at www.medicare.gov. If you go all the way up to the top, far right hand where it says resources, you can download that book. The cool thing is you can download it in 14 fonts, so if you're like me, you've left the glasses in the kitchen, I don't have to get up and move. I can continue to read on, okay? Also, do you need a prescription drug plan? Yes, if you have a Medigap plan. Again, Medicare Advantage plans, most of them include a prescription drug plan. Okay, let's talk about those prescription drug plans. They also have an initial enrollment period. Does this look familiar? Yes, okay? 3 months before, month of, 3 months after. They have a true open enrollment every year, October 15th through December 7th, effective January 1st. So you could change plans each year, okay? They also have a general enrollment, which is April 1st to June 30th, with the effective date of July 1st, only if you're enrolling in Part B for the first time. Now, Part D drug plans have several special enrollment periods. Here are a few. One, if you move to a different state and that Part D plan is not offered. If you qualify or lose extra assistance for low income. If you move into a nursing home. If you have or lose Medicaid, or if you lose credible coverage. They also have a special enrollment period. This is new this year. If you are with a 5-star drug plan, you can access those on the website for Medicare. They give you a one-time chance to change, which would be effective the first of the month following that you made that change. But the new word of the day is, let's talk about what in the world is credible coverage, okay? Every year, my friends at Centers for Medicare and Medicaid Services send out a notice to all of the carriers that are going to offer a Part D drug plan, okay? In there, it gives us guidelines that states, hey, if you are going to offer a Part D drug plan, it has to be actuarially equivalent to this or better. And what that means is it's simply saying that the Part D drug plan that you've selected will on average pay as expected as much as Part D drug plans that Centers for Medicare and Medicaid Services offers, their standard plan. So with that said, most of us pick a drug plan, right, for Part D that is offered by a carrier, like AARP, Aetna, Humana, whatever the case may be. But you could actually buy your Part D drug plan through Centers for Medicare and Medicaid Services. But just remember, you can only have one Part D drug plan, okay? Now, you'll notice there that there's a penalty if you don't enroll in Part D when they feel that you should have enrolled in a Part D drug plan. Now, it doesn't sound like a lot, so it's if you go 63 days or more without having Part D drug plan, right? Then you get a 1% penalty for every month that you're not enrolled, and it's based on the national average. National average cost of Part D drug plans is usually between $33 and $37.50. So a whopping 33 cents a day, right? It doesn't sound like a lot, right? But guess what? It adds up for people. So what's happened is we've had individuals that have been in stellar health as they make their exit into the Medicare world, and they've totally forgotten that they didn't sign up for a Medicare Part D drug plan until they need one. What's happened? They have to pay that late enrollment penalty on top of the cost of the Part D drug plan. So are they forcing us to get a Part D drug plan? Just say yes. And if you don't take a lot of medications, then just find a low-costing one. Does that make sense to everyone? Just find one that meets your needs. Okay. So let's talk about how drug plans overall work. So in the deductible stage, right, we know that you are purchasing your medications and you are getting the discounted cost of those medications, right, their costs for the Part D drugs, applied towards that deductible, okay? Once you've met your deductible, then you're going to start paying whatever coinsurance or copay that your drug plan that you've selected has. A copay refers to a dollar amount. So some of them may say, oh, it's $1 or a $5 cost for your medication. A co-insurance refers to a percentage amount. So maybe you're going to pay a 2% percentage of the cost of your medication, okay? You will pay those copays until you reach the donut hole, most of you know it by that name, or the coverage gap. And that starts at $3,820. So what's the math to get there? To get there, it includes what you've paid in your deductible, right? What you've paid in your co-pays or co-insurances, plus what your Part D plan has paid on your behalf. When all of those things total $3,820, are you in the coverage gap? Yes. Okay. Now, there is catastrophic coverage on Part D plans. Do not get that confused with out-of-pocket maximums. Okay? Catastrophic coverage just means that your co-pays will reduce, but you will still have to pay for something, right? So how do you get to the catastrophic coverage with a Part D drug plan? It's all based on what you've paid. So it would include your deductible and whatever you've paid out in co-pays, right, or co-insurances. And when those total $5,100, you're at that catastrophic benefit when your co-pays or co-insurances will what? Reduce. Okay? Now, you're all looking at me going, oh my gosh, Gabby, $5,100, that's a lot of money. I have people meet that in a month and a half. Okay? So as we go forward, did I forget to tell you guys that Part D premiums are also based on your modified adjusted gross income? They are. Okay? So here are the tables again for this year. So as you can see, if you're just a quasi-state employee like me, I'm not going to get anything added, right? But as your income goes up, as it is reported on your tax return, right? Modified adjusted gross income, you can see the dollar amount that will be added to your plan premium. Okay. Now, you are going to be entering the Medicare world, and you will follow all of Medicare's rules, okay? Let's see how PEHP fits into all of this. So, who is eligible? Anyone that's had PHP coverage, or you're a participant in one of the Utah retirement systems, even if it's just our defined contribution plan. We have a true open enrollment. Every year you can come to us. We do not ask medical questions. You can change plans. You will never be asked medical questions. We offer 3 plans, and we really like to make it easy. The Plan 100 covers 100% of eligible Medicare services and deductibles and your co-insurances, okay? The Plan 75 pays 75% of Medicare eligible services and that have been also the deductibles, right? Always has to be Medicare eligible services. Plan 50, 50%. Now on the Plan 75 and the Plan 50, we do have a true out-of-pocket maximum. So let's say you're healthy when you start out, the wheels fall off the bus, and you become ill. There is a maximum out-of-pocket protection on the Plan 75 and Plan 50 to protect you in that case. So again, no medical underwriting, and I give you the best birthday present ever. When I'm not going to raise your rates when you have a birthday. You will continue to pay the same rates that you started out with us at till the end of that calendar year, right? And you can select a new plan at open enrollment, pick and choose whatever plans that you want. We offer 3 prescription drug plans. The difference is in the coverage gap. And let me pull this up for you. All of our plans have a deductible. Then again, we follow the same guidelines to get to the coverage gap. But I want you guys to look at in the coverage gap. You'll notice that I've listed discounts in the coverage gap. All of the Part D plans have to provide you discounts in the coverage gap, okay? That is how that coverage gap or donut hole will go away. It'll implode. Does that make sense to everyone? So it's based on their preferred generics, right? And brand names. Now, on the Basic Plus plan that we offer, you continue to pay generics in the coverage gap, And on the enhanced prescription drug plan, there is no coverage gap. A heads up too. When you're looking at plans and you're saying, OMG, I don't know what's going to work for me, add up the cost of your prescriptions, the total cost, not what you're paying right now in a copay. If your total prescription cost is less than $3,820, do you need a prescription drug coverage that gives you coverage through the coverage gap? No, because you're never going to get there. Okay, so our plans work on the same premise as we worked through before. You can see you have your deductible. Once you've met your deductible, then you start paying the copays or coinsurances. And to get to that lovely coverage gap again, that includes what you've paid, your copays, and since it's a PHP plan, what PHP's paid. Once that is $3,820, you've hit the coverage gap. Again, same math to get to that catastrophic, that is all on you. It just includes what you've paid in your deductible and what you've paid out in your dollar copays or percentage coinsurances. So, in addition to prescription drug plans, we offer 2 dental plans. And the 2 dental plans that we offer, you are required to use PHP contracted dentists. They are premium plans. This is what they look like. If you come to us from a different dental plan other than a PHP dental plan, we do have a 6-month waiting period on there for implants and prosthodontic services. And if you enroll in one of our Medicare medical supplement plans, we've included in there a discount dental plan at no cost. And a lot of people will ask me, oh, Gabby, really a discount dental plan? It is a good discount dental plan. Again, you're using our contracted dentists, right? But it's based on our business negotiated fees. So you would pay those fees at the time services are rendered. Let me get back to this. Sir, you had a quick question.
Back on the drug plan, so if you don't meet that $415 deductible, and you choose not to, I'm not sure whether I have that supplement or, so are you getting, my question is, are you going to get penalized if you don't have that with your supplement under Medicare when you finally decide to sign up for that?
Okay, again, Part D drug plans have their own penalty if you don't take it when it's eligible for it, okay? This is the standard Part D plans. There are other choices out there that you could look at, okay? But if you don't take a Part D drug plan when you should have taken one because you've gone 63 days or more without credible, right, as good as the Part D standard plan with Medicare, right, drug plan, then you will get that 1% penalty. You could choose to enroll in the Part D drug plan that Medicare offers, but again, most people choose to enroll in a Part D drug plan that is offered by a carrier. You don't have to have both, just one, and you can make that choice.
So the PEHP meets that requirement?
Yes, we do. Okay. So as we go forward, we do offer vision plans as well. Now, this is what's fun about Medicare. Medicare will cover a foreign object in the eye, glaucoma, or cataracts. Can you tell I've been around the grandkids way too much if that's the first thing I say? They will not cover basic refractive, okay? So if you have glasses, I suggest that you get a vision plan or negotiated discount, okay? I have no line bifocals, right? I have great vision for distance, but it's close up that is difficult for me. And I got tired of taking my readers off and on, off and on. So I went with the no-line bifocals. It's just easier for me to do that, as you can see. So if you want a eyewear plan to save money, this is what I suggest. One of you take the vision plan 1 year, right? And then the next year, your spouse takes it, because usually our prescription is good for 1 year. Does that make sense to everyone? Okay? So just keep that in mind. I did bring detailed books that have what our prescription drug, our vision plans look like, and it's also available on our website. This is what the enrollment guide looks like, and with PEHP, we make it easy. You can pay for your premiums from your pension with us, so it makes it a little bit easier. What to consider is cost. I don't know what your income looks like, but pick a plan that not only fits your needs, but fits your budget, okay? What to consider with pharmacy. One, we talked about making sure that that is a credible prescription drug plan, right? We also talked about, are your prescriptions covered? Costs can vary by plan, and it can be higher based on your income. But this is what I want you guys to do, is to get to the true math. I had a couple last year switch to a lower costing Part D plan, and it actually ended up costing them more money. Why? Because they didn't look at the co-pays of what her spouse's medications would cost. And on the lower costing drug plan, the cost of his medications were higher. So when you're comparing these drug plans, right, make sure that your prescriptions are covered and look at what the copay or the cost of those drugs are for you to pay for, right? And then put in the premium, right? So you're comparing the true cost. Does that make sense to everyone? Get to that true dollar amount. I just don't want any of you to get surprised. All right, make sure they're licensed. All of the plans are licensed in the state of Utah. If you have a broker help you, great. Make sure that they're licensed. Look at what you're going to be doing, okay? Are you going to be traveling? Are you going to be traveling outside of the country? These things will all help you decide what type of plan will work best for you. I married a cowboy. Going to Salt Lake is out of the country. Just kidding. But since I'm going to live and reside in the service area, right, a no-cost, low-cost plan could work for us, okay? So as I go forward, what to consider. If you have health savings account monies, oh my gosh, use those to offset your Medicare costs, deductibles, prescriptions, all kinds of things. Some people may have money in a health reimbursement account. Same thing. Use those monies to offset some of those medical expenses. Helpful hands? Yes?
Just a stupid question. When you go to Salt Lake, do you need a passport?
I don't know. For him, probably. It was an arm and a leg to have him travel to Washington, the state of Washington, to visit our oldest daughter. I have to leave the animals. So I said, fine, we have a babysitter for the horses, right? We took the dog. Okay. All right, so create a mymedicare.gov account. The reason I'm saying that is they still send claims quarterly. So if you want to see what they've paid for and you want to make sure you received what you paid for if you're on durable medical equipment, get that, okay? You can check it out. Finally, all Social Security numbers have been removed, right? They should have been the first ones to do it. And then if you're in the hospital for more than 24 hours, right, and you've been watched, they have to give you, I didn't make this up, a moon notice, right? It's called a Medicare Outpatient Observation Notice. Why is that important for you to receive or to know? Because you need to know how your benefits are going to pay, right? And I always tell people, always ask, are we inpatient yet? Are we outpatient yet? Right? Ask. Always ask, is this a Medicare eligible benefit? Okay? This is imperative that you understand this. Regardless of the Medicare health plan that you choose, even if it's a Medicare Advantage plan, for medical benefits, they're only going to pay if it's what? A Medicare eligible benefit. So if they're going to give you a test ask them, is this a Medicare eligible benefit? That's imperative. I don't want you guys to get stuck with something. Okay, this is cool. They now have a blue button, okay? You can actually download all of your information, your chart information from Medicare, okay? But I'm going to tell you what I want you to understand, that as it's being downloaded, it is protected to get to you, right? But it is your job to protect your information if you are going to share that with your facility or your doctor. Most of us, most of the physicians now have that little patient thing that you sign into and you can chat with them. Because, oh my gosh, nobody speaks to anybody anymore. It's either texting or emailing, right? And so before you go attaching your personal health documents, make sure you feel comfortable that how you're communicating with them is encrypted and protected. Does that make sense to everyone? Just be careful with that. Okay. Then you can now have a Medicare on the go button that you can download on your phone. How sweet is that? This is what it looks like. And it will tell you preventive services if something's covered. But there is something it cannot tell you if it's covered because it's just a mobile app. And that is, let's say you're going in for a knee replacement. It is not going to be able to tell you if the device that they're implanting in your knee is a Medicare eligible device. Does that make sense to everyone? So with that said, our friends at Medicare are now available 24/7, 24 hours a day, 7 days a week. They only get Christmas and Easter off. So when is the best time to call our friends at Medicare? 2 in the morning, they pick up. Just kidding. Not that late, but maybe later in the evening, okay? If you try to call them during the day, honestly, you will wait. And because they're getting a high call volume. So try to call, have all your questions ready for them, okay? All right, mix and match the plans with PHP. You can come to us for just a vision plan, pharmacy, whatever it is that you feel meets your individual needs. And you can come to us during open enrollment or a qualifying event like leaving active employment. Here are all of the resources available to you. I would like to say that all of the counties throughout the state of Utah have fantastic departments of aging services that can go in there and assist you with any questions as well. There are people that can help you. Also, let me just flip to my reference slide in case I have any teachers with me today. They'll know I was a good girl, okay? And then I'll switch it back to this and we'll just keep this up. And with that said, I would like to thank all of you for coming out and learning a little bit more about Medicare. And the biggest thing is try to plan in advance, ask questions, and know what you're going to do as you go forward in your retirement world and look at your budget, okay? Thank you so much. You guys are awesome sauce. I'll be here after if you have any other questions. Thank you.